Hello, we will be presenting some very important information on 3 topics today. Karen Brand, our nurse from Hampton Academy, will be discussing bloodborne pathogens. I will be discussing AED training, and my name is Kathy Conley, and I work at Marston Elementary. And Beth Maloney, our nurse from Center School, will be presenting the 3rd portion of the presentation, and she will be discussing allergies and anaphylaxis.
Bloodborne pathogens are infectious microorganisms in human blood that can cause disease in humans. These pathogens include, but are not limited to, hepatitis B, hepatitis C, and human immunodeficiency virus. Needle sticks and other sharps-related injuries may expose workers to bloodborne pathogens. Workers in many occupations, including first aid team members, housekeeping personnel in some industries, nurses, and other healthcare personnel, may be at risk of exposure to bloodborne pathogens. All occupational exposure to blood or other potentially infectious materials place workers at risk for infection with bloodborne pathogens. OSHA defines blood to mean human blood components, and products made from human blood. Other potentially infectious materials mean the following human body fluids: semen, vaginal secretions, cerebrospinal fluid, amniotic fluid, saliva and dental procedures, any body fluid that is visibly contaminated with blood, and all body fluids in situations where it is difficult or impossible to differentiate between body fluids. Waste products, including urine and feces, are also potential sources of infection. If you come across some spills such as blood, don't touch it. Cover it up. Call maintenance either by walkie-talkie or your classroom phone. Make sure that no one will be coming to either sit or stand in it. If you can't wait, put on your gloves. You can always tear this off. Dump it in the trash, and wait for facilities to come. When you take your gloves off, take them off carefully so that they're double gloved. Throw them in the trash. Make sure you always wash your hands. Remember, the rule of thumb is the length of time it takes to sing the happy birthday song. For those of us who can't sing, like me, sing it to yourself quietly. If a child runs up to you with a bloody lip or a bloody tooth, as much as you want to help them right away, stop. Put on your protective equipment. Put your gloves on, because remember, even though they look harmless, that child may have a bloodborne pathogen that you do not know of, as well as you may have something that you don't want to spread to the child. Okay? Grab a tissue or a paper towel or something that you can help. Mop them up. All right. Ask them to keep it there, hold it, and call for the school nurse or the maintenance person. Okay. And remember, when you're done wearing the gloves, you have to double glove them. When you get inside, make sure you wash your hands for the 2 minutes. Personal protective equipment is specialized clothing or equipment worn by an employee for protection against a hazard. Universal precautions is an approach to infection control. According to the concept of universal precautions, all human blood and certain human body fluids are treated as if known to be infectious for HIV, hepatitis B, and other bloodborne pathogens. Do not attempt to clean emesis, blood droplets, or other body fluids from surfaces. Please utilize the in-house custodial staff to properly clean and dispose of potential pathogens. Our custodial staff has received training and have a ready supply of the appropriate personal protective equipment and cleaning agents needed to safely manage the scene. Gloves are latex-free, powder-free, and made of synthetic PVC material. Store your gloves at room temperature, away from moisture, direct heat, and light. Do not reuse gloves. They are for single use only. When removing gloves, touch the glove only with the other glove and discard both in the trash. Always wash your hands after removing gloves. Beth is wearing modeling personal protective equipment. such as you may see maintenance people. Protect your clothing,
Booties.
the booties, the different kinds of masks.
Very stylish.
That kind, or there's always this kind of mask. And if necessary, the protective eyewear.
Event that a person collapses or is found unconscious, first determine whether the person is unresponsive. Give a call for help. Survey the scene, make sure it is safe to enter. Call the main office and access EMS. The Hampton Fire Department number that should be called is 926-3315. Grab the automated external defibrillator, the AED machine. Open the machine, turn it on, and follow the instructions. The AED is designed to combat cardiac arrest or heart attack brought on by an irregular heart rhythm. The AED delivers electronic shocks to the heart. This stimulates a return to a more normal rate and rhythm. This automated portable device will assess whether or not a person in question needs an electronic current or shock. If the person does need a shock, the device will determine the wattage or power level. The Good Samaritan law protects those people who try to help others. Do not fear. Prompt use of the AED can potentially help save lives. In the event that a person collapses or is found unconscious, you first want to determine whether the person is unresponsive. Then you want to survey your scene before rushing on in. Give a call for help. And you want to grab your AED defibrillator, which is the automated external defibrillator. You want to open the machine, turn it on. We're going to go through that in just a moment. But first I'm going to tell you a little bit about the AED. The AED is designed to combat cardiac arrest or heart attack brought on by an irregular heart rhythm. The AED delivers electronic shocks to the heart, and this stimulates a return to a more normal rate and rhythm. But no need to fear. If the person does not need a shock delivered, the AED will not deliver the shock. So basically, if the person is in ventricular fibrillation, otherwise known as VFib, then you will give your shock via defib. Simple as that. Defib for VFib. You don't need to worry about anything. And this automated portable device will assess whether or not the person in question needs the shock. If the person does not need the shock, if the person does need the shock, it will determine the wattage and the power level. So do not fear. Potential for misuse is minimal. Prompt use of the AED can potentially help save lives. Now we're going to do a little demonstration on how you would use the AED. Very simple. You want to grab it off the wall, out of your cabinet at your school. Open the machine. First thing you're going to do is turn it on.
Call for help now. Remove all clothing from patient's
Oh no,
chest.
the nurse is down. Who's going to help the nurse? You grab your AED. The first step that you normally would want to do is open it up. Today I'm just going to simulate and go through what we would do without the machine prompting me on what to do. But you would open your machine, turn it on would be your first step. Very simple. You're just going to look at the pads. These are adult-sized pads. For children 8 and under, we would use a smaller size pad, which is a PD pad, and that would be already set up for you. And you simply are going to remove the clothing on the victim, place your pads right, the electrodes right where it's telling you to place them. Like I said, your machine is on and it's prompting you what to do, and it's simply going to advise you when to give a shock, if and when to give a shock. And that's all there is to it.
The AED at Center School is located outside the gym in room 125. The AED at Marston School is located outside the gym near the library entrance. The AED at Hampton Academy is located just outside the lower gym.
Anaphylaxis, pronounced Anaphylaxis is a serious allergic reaction that is rapid in onset and may cause death. Common causes of anaphylaxis include food, medication, insect stings, and latex. Although any food can cause a severe reaction in someone allergic to it, peanuts, tree nuts, shellfish, fish, soy, wheat, milk, and eggs are the most common causes of food-induced anaphylaxis. Only a trace amount of a problem food is enough to cause a reaction in some people. Less common causes include food-dependent, exercise-induced anaphylaxis, which occurs when a person eats a specific food and exercises within 3 to 4 hours after eating, and idiopathic anaphylaxis, anaphylaxis with no apparent cause. Who's at risk for having an anaphylactic reaction? Anyone with a previous history of anaphylactic reactions is at risk for having another severe reaction. Individuals who have asthma in addition to food allergies may be at increased risk for having a life-threatening anaphylactic reaction to food. Symptoms of an anaphylactic reaction include the reaction beginning with a tingling sensation, itching, or a metallic taste in the mouth. Other symptoms can be hives, a sensation of warmth, coughing, swelling of the mouth and throat area, wheezing or other difficulty breathing, vomiting, diarrhea, cramping, and ultimately, most seriously, a drop in blood pressure and loss of consciousness. The symptoms may begin within several minutes to 2 hours after exposure to the allergen, but life-threatening reactions may get worse over a period of several hours. Epinephrine is available by prescription in self-injectable devices called EpiPen and Twinject. It's important to administer epinephrine as soon as one detects the symptoms of anaphylaxis. Administration of epinephrine requires transfer to an emergency facility for observation and possible further treatment. An ambulance must be called anytime epinephrine is administered. Anaphylaxis is a serious allergic reaction that is rapid in onset and may cause death. Intramuscular or IM epinephrine injected into the anterolateral aspect of the thigh, that means the outer section of the thigh, is the choice for treating an anaphylactic reaction. It works to reverse the symptoms and to help prevent its progression. Generally, the rule of thumb would be 55 pounds and under 0.15 epinephrine would be used, and for 55 pounds and over, 0.3 epinephrine would be used. There is a difference, if you notice, in the color of the ampules that it comes in. So to give epinephrine, you open the cap and remove the auto-injector from the carrier. Never put your thumb, your hand, or your fingers over the orange section. That is where the needle comes from. Grasp the injector with your hand formed into a fist, and with your other hand, remove the blue safety cap. It's now live. If you imagine a line down the center of the thigh and look at that outer aspect, that's where you're going to put the injector, and you're going to hold it firmly in place until you hear a click. Count to yourself 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. It will seem like an eternity, but it's important that all the medication gets to the victim. Then remove it, and as you can see, the orange extender will come out over the needle and protect you from an accidental poke. Keep this and give it to the emergency medical personnel that arrive on the scene. For any time that an EpiPen must be given, an ambulance will be called, as the person might need further treatment. Do you want to just show the green one?
Sure.
So we flip the cap open and remove it from the carrier tube. Remember to make a fist, grasping it around the center. Remove the blue safety cap, and the medication is now active. With a firm pressure, 90-degree angle. clear audible click. We wait 10 seconds and then we remove it. And once again, you can see with the newer device, the orange comes out over the needle. Antihistamines such as Benadryl and steroids such as prednisone are often used to help the recovery of a person with an anaphylactic reaction. Antihistamines and asthma medications such as albuterol may be administered with epinephrine, but never instead of epinephrine during anaphylaxis because they cannot reverse many of the symptoms of anaphylaxis. The 3 R's for treating anaphylaxis: recognize the symptoms, react quickly, and review what's happened to be sure to prevent it from reoccurring. Cross-contamination is a concern. One example I think is easy to remember would be I'm using peanut butter and jelly. If you're making a sandwich or preparing some food, you use peanut butter on a cracker or some bread and wipe it off, and then you put the knife into the jelly so that you can put jelly on a different sandwich. You've just cross-contaminated the jelly. So it's very important to think when you're preparing food or whatever allergen might be affecting the person, that spreading it from one surface to the other is a no-no. Prevention. Conventional cleaning techniques are effective in removing allergens. Hand washing is the best way to remove protein substances from the hands. Soap and water with friction is the single best way to remove protein substances from the hands. Antibacterial wipes and hand sanitizers may not be effective in removing proteins from the skin. Cross-contamination occurs when the offending substance is introduced to another area. Avoid food sharing and cross-contact. The best strategy to prevent an allergic reaction is avoidance. Food allergen avoidance in the classroom, in other words, craft projects and parties, is essential.
We invite any willing staff member to visit your school nurse and practice using an auto-injector. This will help you gain the confidence you need to act quickly and proficiently in the event of an emergency.
When you grab the EpiPen, make sure you grasp it like a fist. Do not hold it like this and take the cap off and put your thumb over it, because if you inadvertently put your thumb over the needle part and you go to push, you've just injected yourself with epinephrine. You too will be getting a free ride in the ambulance to the hospital. Meanwhile, the person on the floor who can't breathe is still waiting for their epinephrine.
One of the other things that folks tend to do is they tend to inject and pull it right out. And as you can see, the medicine will fly right out of the end. So unfortunately, the person that needed the EpiPen did not get the epinephrine. So take care to count while it's injected in the thigh. And do a few seconds, even though it feels like a really long time because you're really anxious. Give it the 10 seconds.